Hi, I'm Patrick Mazi. I am a physician and an assistant professor of medicine at Washington University in St. Louis. I have expertise and training in both infectious disease and critical care medicine. My clinical and research interests are looking into improving patient outcomes for folks with a diagnosis of fungal infections. Um, as sort of an extension of that is that we are starting to see many types of fungal infections that historically we haven't seen much in North America. And so these have, complicated sounding names like chromoblastomycosis and eumycetoma. But really at their core, they're fungal infections that affect the skin. And for, most of modern medicine, we have sort of linked and localized these types of infections to sort of the tropical belt or sort of the areas, just north and south of the equator. As sort of we see climate changes going on, we see expansion of the habitats where some of these fungi like to live. And so, places further north are being warmer for larger parts of the year, allowing these, different types of fungi to live happily at latitudes that are a lot broader than what we originally would attribute to them. As a result, we're seeing more and more infections and other neglectable tropical diseases, particularly the infections, in areas where historically we haven't seen very many of them. And so that presents a diagnostic challenge for people caring for folks is if it's something that you haven't seen, how do you diagnose it? And so I would also like to mention here that this isn't just specific to fungi. And so we have, other diseases like Chagas disease, which is also called American trypanomyosis. We have cysticercosis, leishmaniasis, endemic typhus, even going back to Yersinia pestis, or, it was known as the bubonic plague, that is, we're seeing more of that. Mycobacterium leprae, which is the causative agent of leprosy, which has now been updated to be called Hansen's disease. But that sort of is present in armadillos. And so as someone in St. Louis, I wasn't familiar with armadillos, but they're tracking more and more north. And so now it's something that we see from time to time, even on our highways. And so we know people are having more contact with, animals or soil or, being bitten by mosquitoes or ticks that can sort of bring these infections to a population of people who were thought to be unlikely to have these. And so going back to the diagnosis of something that you're not familiar with, I think that it's really important for providers to sort of cultivate a thought or sort of a cognitive approach of wait, what? And so you have seen the things that, are very common locally. And so community acquired pneumonias and, staph infections, causing a skin and soft tissue infection. And so when you approach the problems and, it's not responding to treatment or it's coming with a lab abnormality like high eosinophils in a CBC, there should hopefully trigger in your mind a wait, what? And so if you thought that it was something and there's just a detail that sort of sticks in your mind of like, this is really hard to make sense of. And so maybe it's an exposure, maybe it's sort of an interaction with an animal that just sort of like, man, this just seems off. It's okay not to know specifically what it is and sort of to be able to make the diagnosis right off. But it's the idea of the wait, what that should trigger. I probably need to investigate this more. And so maybe that's going to, the internet to sort of look up symptoms or sort of where some of the, these types of infections have expanded their geographic distribution to and say, oh no, I do have Chagas disease that's increasingly present sort of in my local area, or, coccidiomycosis. And so that's a fungal infection that, predominantly was thought to be in the southwest of the United States. We found it up in Washington state and along the Canadian border. And so again, simply knowing everything is not possible. but sort of cultivating the idea of that something about this doesn't quite fit. Maybe I should go look it up or ask somebody with a little bit more experience. And so I think that just like I said, the cultivation of that and sort of being humble enough to recognize that you don't know everything and to seek help. Again, whether that's information on the internet or consultation of an expert, these things are going to be becoming increasingly present, and we're going to see them more. And again, just trying to figure out the earlier that we can sort of get these identified, diagnosed, and treated, the better for our patients. And as a message to patients that are wondering what their diagnosis is and frustrated that they're not starting to feel better, I think that it's really appropriate to sort of bring up to your provider that we've tried a treatment for a specific diagnosis and it didn't work, and rather than sort of doubling down and trying it, antibiotics for a different antibiotic or an antibiotic for longer, it's sort of asking, hey, let's take a diagnostic pause and sort of consider anything else that this could be. One of the other things, and again, that's totally appropriate, like as a patient, to ask your provider to say, hey, just want to take a pause here and just make sure that we're thinking about all the possible options for a diagnosis. But the other thing that patients can be doing is, if there's something that's been a little bit unique that no one has specifically asked you about, but it's something that was sort of a little bit more unusual sort of in your day-to-day life. Maybe you went on a float trip and sort of noticed that you had a rash at the end of it that initially went away, and then now it's sort of progressed differently. And so sort of telling your providers about, we did run over that armadillo and wanted to get it off the road, and so we scooped it up and put it off to the side. There's many things within our lives and within our days that are a little bit abnormal, and that may have been the one clue that your provider needs. And so I would always err sort of on the side of oversharing sort of those things, just to sort of give your provider as much data as possible to help them make these sorts of less common diagnoses. And I think that ultimately will get you diagnosed a lot faster.